This is a presentation on cultural factors and health disparities in rural populations by Michelle Morse. Some primary health concerns with rural populations include low socioeconomic status, housing insecurity, lack of access to affordable and nutritious foods, lack of adequate infrastructure, low literacy and educational attainment rates, lack of reliable transportation, lack of access to healthcare services, and inadequate health literacy. Long travel distances to specialized and emergency care can lead to poor health outcomes. Children in rural communities with behavioral, mental, and developmental disorders experience more challenges than children in urban areas. There is a higher incidence of smoking and less physical activity in rural communities, which can lead to higher mortality rates in rural areas. According to the CDC, rural Americans are at a higher risk of dying from stroke, chronic lower respiratory infections, heart disease, cancer, and unintentional injury than those who live in urban areas. So, media portrayal of rural populations tends to over-rely on stereotypes and broad generalizations of rural populations. In the last 5 years, 1 in 5 newspapers have been shut down, and over 500 of those have closed in rural communities. This has caused an underrepresentation of rural voices and issues due to lack of local media coverage and oversimplification of rural issues and people by national media outlets. Parachute reporting on the part of national media outlets is often blamed for misrepresentation of rural communities and perpetuating rural stereotypes. National reporting after the 2016 election focused on rural America as backwards, bigoted, racist, and unintelligent. Rural media stories that are most appealing are those that portray the realities of living in rural America and are not written by national reporters but by the locals themselves. So if you really want to get to know people in rural communities, the best thing to do is go straight to the source and to the people who live there and get to know them and learn their stories. When the overall well-being of parents is lacking, the health and well-being of children suffers as a result. Children, adolescents, and older adults are most vulnerable to social determinants of health in rural communities and need the most support. Compared to urban areas, people in rural areas are more likely to know one another and to lean on one another for support. This can lead to strong relationships. However, there's often peer pressure to conform to certain ideas. Peer influence in rural communities may contribute to increased alcohol and drug abuse, higher smoking rates, and decreased seatbelt use. Culture in rural communities can impact use of medical services and the effectiveness of educational and environmental interventions that encourage the adoption of healthier lifestyles. Rural communities often value self-sufficiency and independence, but may exhibit stoicism and fatalism in regards to health and illness. Poverty in rural communities places children at risk for poor health outcomes and can have lifelong impacts. Poverty rates are typically higher in rural communities versus urban communities. Lack of education, lack of job opportunities, lack of transportation services, and physical isolation put rural residents at higher risk for poverty. Depression is a common stressor experienced by rural low-income mothers and negatively impacts their ability to parent, which can lead to unhealthy coping behaviors in children. Food insecurity, food deserts, and decreased access to healthcare resources, housing and job insecurity, mental health disorders, substance abuse, obesity, diabetes, and cardiovascular disease have all been cited as challenges specific to rural Americans. Rural America tends to have higher concentrations of people with conservative political views versus higher concentrations of people with liberal views in urban areas. The urban-rural political divide has been found to be linked primarily to geographic proximity to metropolitan areas versus differences in the type of people living in these places. How close people live to cities has a significant influence on shaping political beliefs and party affiliations. Because federal and state policies tend to focus on rural areas through a lens of agriculture, mining, and manufacturing, many of the policies created that are intended to help rural populations actually do not benefit rural America as a whole because rural issues are much more diverse than portrayed by the media. Residents in rural communities often delay seeking treatment for health concerns due to lack of convenience, transportation, lack of health insurance, and other factors that decrease chances of recovery. According to the CDC, rural Americans are at higher risk of dying from stroke, chronic lower respiratory infections, heart disease, cancer, and unintentional injury than those who live in urban areas. Residents in rural areas experience higher mortality rates than their urban counterparts due to socioeconomic deprivation, lower education levels, lower health insurance coverage rates, and an extreme shortage of primary physicians. The lower the socioeconomic status of a community, the worse the overall health of that community will be. Socioeconomic and educational status affect where people will live, work, and play, their ability to provide for their basic needs, and employment opportunities. Rural communities tend to experience higher rates of poverty than urban communities, and this puts them at risk for greater health disparities. Only 20% of the health of an individual is determined by traditional health care, while 80% is determined by socioeconomic factors, health behaviors, and the physical environment. Although rural America is proportionately less diverse than urban areas, rural areas are still populated with people of color, immigrants, LGBTQ individuals, and those who are disabled. Studies have shown that people of color in rural communities face even more challenges than the typical rural population. 4 out of 10 Native Americans, for example, rate their quality of life as fair to poor due to socioeconomic challenges. LGBTQ individuals in rural areas may face discrimination and have difficulty gaining fair access to health care, housing, and job opportunities due to their sexual orientation and gender identity. 1 out of 10 African Americans live in rural areas, with the highest concentration living in the southeastern part of the U.S. These communities face significantly higher rates of poverty than other rural populations. Approximately 1/5 of Americans live in rural areas, and 10% of the country's gross domestic product is generated in rural communities. 97% of America's landmass is considered rural. Geographic location can be isolating and make access to primary and specialized healthcare difficult, if not impossible, for some rural populations. Health status of rural populations is directly influenced by their ability to access and utilize healthcare services. Rural residents will likely experience poorer health outcomes. Barriers such as lack of reliable transportation, travel time, lack of health insurance, stigmas within local communities surrounding certain health conditions, and health literacy all impact access to health care for rural residents. People living in rural areas tend to favor traditional values and may be resistant to new ideas. People living in rural communities may also harbor some resentment towards people living in urban communities and feel that those living in urban areas receive more funds and resources than is fair. Additionally, residents in rural communities may feel looked down upon by their urban counterparts. The media makes this issue worse by perpetuating rural stereotypes and focusing media coverage primarily on urban issues. Many people assume that rural America is primarily white and conservative. Because of this stereotype, there are many diverse and rich rural narratives that get left out of the picture of what it means to be a rural American. In order to address health disparities in rural communities, the best thing we can do is to address the social determinants of health specific to those communities.